Yeah, tummy tuck removes stretch marks. See, a tummy tuck or abdominoplasty is a surgical procedure where excess skin and fat is removed from the tummy and the muscles are plicated. So the tummy becomes flatter, more toned, and more aesthetically pleasing to the patient. This is usually the common form of a tummy tuck. However, there are various types of tummy tuck. So what I've just described is just a full abdominoplasty where remove the excess skin and fat from the lower tummy, tighten the muscle, and bring out the umbilicus through a space which we create within the skin flap. But there is a mini abdominoplasty where the focus is just to remove the excess skin and fat from the lower tummy. The muscles commonly we do not placate or tighten. If one has to tighten, it's just in the lower part of the tummy. Unlike in a full abdominoplasty where you tighten the muscles centrally. The two muscles, what's called the recti abdominis muscles, are look separated. You tighten them to bring them together. Then there's also a flow-delay abdominoplasty where excess skin and fat is removed, not just in the horizontal plane, like a common tummy tuck, but also in the vertical plane. So the patient is left with what looks like an inverted T kind of incision or scar. There's a reverse abdominoplasty. The reverse abdominoplasty, as the word says, or the phrase says, is a reverse of the standard tummy tuck. So usually for patients who lost a lot of weight and there's a lot of excess skin and fat in the upper tummy. So this is removed, and usually the incision is hidden under the breast crease. Now, an ideal candidate for a tummy tuck has to be somebody who has a stable weight, who is healthy. Usually somebody maybe they have some weakened muscles, maybe from age, weight loss, or pregnancy. That'd be an ideal candidate. The way to prepare for the surgery is to listen to your qualified plastic surgeon. Usually there'll be instructions during the consultation or even what's called the preoperative assessment when the nurses would talk to you and say, these are the things for you to get ready. Obviously, remain healthy. After the surgery, you may need some kind of loose clothing. If you're somebody who has young children, probably get some arrangement, somebody to help you immediately afterwards, after the surgery. The surgery usually is done under general anesthesia. And what it involves is usually lifting the skin and fat of the tummy, from the lower part of the tummy upwards, through the full length of the tummy, tightening the muscles, sometimes called plication. That's the muscle, so it gives the patient a flatter board. Then the umbilicus of the navel is brought out through a space within the skin flap, and the excess skin is then removed. The patient ends up with what's called a bikini incision scar or bikini scar, because there's somebody wearing like one of those bikinis. So that's why the scar is a horizontal scar on the lower part of the tummy. Now, if it was a flow-delay abdominoplasty, the excess skin also is taken centrally, so the scar would be like an inverted T, as I was mentioning. But if it is just purely a mini tummy tuck, the excess skin and fat is taken from the lower abdomen. And if it was a reverse abdominoplasty, the excess skin and fat is taken from the upper abdomen. The surgery for a standard tummy tuck normally takes about 3 hours. To be fair to say, it takes about 3 hours. Remember that even though the surgery takes about 3 hours, you may stay in the theater for longer, because when you get to theater, it takes time to get ready for the actual surgery to be done. And when the surgery is finished, you have to recover as well, or go to what's called the recovery room before you actually go down to the ward. So, for example, if you come with a relative of yours and the relative says, I'm only going to be there for 3 hours, if by 4 hours or 4.5 or 5 hours don't come back to the room, they shouldn't really worry, because all these things take time. When we say 2 to 3 hours is for the actual surgery itself. But again, this may be different. It depends on what you're having. For example, if you're having a combination with a liposuction, that will take longer. You see, tummy tuck can be combined with other procedures like breast surgery and reduction, and this ones take significantly longer to finish. Yeah, tummy tuck removes stretch marks. But the stretch marks it removes is the stretch marks within the piece of skin that is excised. It is not surgery for tummy tuck, for stretch marks. to have that in mind, because some patients do present to the clinic and say because of the tummy tuck. If you don't really have this excess skin and fat to be addressed, maybe that wouldn't be the right surgery. Post-operative recovery is one of taking the pain medications, mobilizing gently. It takes about 5 to 7 days for patient to begin to walk straight. But while within the hospital, normally the physiotherapists will give you some kind of chest physiotherapy to expand the lungs. Because the surgery of a tummy tuck, actually, when he pushes down, flattens the tummy, he pushes what's called the diaphragm, which is the muscle that separates the lungs from the intestinal contents. And what happens is that the pushing against the lung can cause small areas of lung collapse and even an infection. So it's important to expand the lungs fully. And if a urinary catheter has been put in, also remove the catheter. And then after about 5 to 7 days, when the patient is walking straight, they continue to begin to do more walks. In about 2 weeks, you begin to do much even longer walks. In about 6 weeks, most patients are back at work. But during this 6 weeks period, you have to wear a support garment or pressure garment. In my practice, I give you 2 copies of that. So when one is washing the washing machine, you can use the other one. So I think that's important. And we notice actually as time goes on and the swelling reduces, sometimes people can even go down to a smaller size of a pressure or support garment. But that's important. The support garment helps reduce the discomfort, and that can happen following surgery. And even the swelling that happens during. So the support garments are useful. And also when you start exercise, formally going to the gym in about 6 weeks. Another thing that people always ask is, are you going to have scars? Of course, if you have surgery, there are going to be scars. But one thing about being a plastic surgeon is that we try to hide the scar within skin creases. So for the bikini incision is done in such a way that wearing the bikini actually hides the scar, or your undergarment should hide the scar. That is the aim. So there will be scars, but it's positioned in such a way that they can be hidden by your undergarments. There can be complications with every kind of surgery. The complications like infection, bleeding, wound breakdown, complications regarding the anesthesia. It is all discussed during the consultation, and we try to reinforce it afterwards. But the most important thing is that they're not that common. Even when they happen, what happens with being a plastic surgeon, working in a good facility, is that you learn how to manage these complications. Definitely, you can combine it. You can combine it with other procedures. Liposuction with the tummy tuck is common. The things you can combine it with breast procedures, all that kind of cosmetic procedures, you do combine it with that. Insurance doesn't. The insurance companies, most of them do not cover this because rather it's a cosmetic procedure. The results are usually long-lasting, but post-operatively or down the line, it is important to maintain a stable weight. Excessive gain in weight can change the appearance. Pregnancy can change the appearance. Somebody asked me whether it can affect whether they can be pregnant. I said, well, tummy tuck doesn't stop what makes people become pregnant. That's what it doesn't. So somebody can become pregnant, but remember they may change their appearance because the hormonal effects of the increase in weight that happens and the stretching of the with pregnancy may change the appearance. That's why the advice is usually to wait afterwards. And if you're going to have it after childbirth, it's always better to wait at least 6 months or more before having the tummy tuck. Here, in terms of weight loss, tummy tuck per se is not a weight loss procedure. However, it does help weight loss. And the reason I say that is my experience is that some patients come to have a tummy tuck and they say that they find it difficult to exercise because of what they're carrying in their lower abdomen. Sometimes they're ashamed or embarrassed to expose their body in places where the outdoor sports like swimming. So the psychological boost of actually removing this excess can make them do the exercise and they achieve the weight loss. Not that tummy tuck per se is a weight loss procedure, it's actually just a body contouring procedure. For example, if someone lost a lot of weight, so there are two sides of it. If you lost a lot of weight, you can do the tummy tuck. You can do the tummy tuck as well. And also for those who are trying to lose weight as well, doing the tummy tuck helps them lose weight. So that's why it does help. But I think it is advisable for your GP to know. You see, I think the GPs do have a panoramic view of the medical history of a patient. So So that's important. I advise patients that it's reasonable to get the GP to know that they're going to have such surgery. Or even, and I get the permission of the patient to write to their GP so they're aware that that is happening. Going back to what we were discussing earlier, the navel is not, is retained for most patients. Only just bring out the umbilicus through the skin, except in some patients, I said earlier, who have excessive skin and fat and a very long and stretchy umbilicus that may not survive afterwards. Then that decision is made. Usually this is discussed during the consultation. Yes, the way you find a qualified plastic surgeon, obviously do your due diligence. But I always advise it's important to have a face-to-face consultation with your surgeon. Well, the reason that is important is good to develop a doctor-patient rapport before you have the surgery with the surgeon. They'll be able to allay some of your concerns that you have, answer your questions, show you pictures of previous patients. Tummy tuck is a quality of life procedure. There's no need for you to rush it. Take your time, do your due diligence, make your choice of plastic surgeon. Go and see the surgeon. Well, if you want to see me, contact my office. Yeah.